We may have all heard of gallstones, but what actually are they? I'm here today to tell you all about the gallstones. Hello, I'm Dr. Ed Hope and welcome to Sick Notes, where I try my very best to explain medical terms in plain English. This one is about gallstones. Gallstones are tiny stones that originate from the gallbladder. They're about half a centimetre to a few centimetres in size and very common. Around 1 in 10 people have them, but the vast majority don't have any symptoms from them. To understand them better, I'm going to do a quick biology lesson. So here's our digestive system. This is our esophagus, our food pipe, our stomach, and this goes round to the rest of the intestine. Now let me draw on the liver. And now let me draw on the gallbladder and the ducts that connect it to the liver. So the gallbladder is a pouch-like organ that lives in the upper right quadrant of the abdomen, just below the liver. Its job is to store bile from the liver and then later on release this bile into the intestine when we eat food. The job of the bile is to mix with the food to help us break down and absorb fats. As we can see, there's a series of ducts here that connect the gallbladder to the liver, to the pancreas and to the intestine. This whole system is called the biliary system. So when we eat food, it comes down the esophagus into the stomach, and when it moves around into the intestine, the cells of the intestine let out chemical messages in the blood that go to the gallbladder and tell it to contract. This forces the bile down the biliary system and into the intestine, where the bile does its job of breaking down the fats. The bile itself is made up of cholesterol, salts and pigments, and it is the cholesterol that precipitates out of the bile and makes stones, kind of like how you get limescale in your kettle. Gallstones are more common in women, people over the age of 40, and people who are overweight. As I said earlier, most people with gallstones do not have any problems with them, but that's not to say that gallstones can't cause problems. So let me show you on our diagram. I'll draw a couple of gallstones in the gallbladder. If a stone moves out of the gallbladder and gets stuck in one of the ducts, this will cause severe abdominal pain, what we call colic, and because it's happened in the biliary system, we call this biliary colic. So if our gallstone got stuck here in the neck of the gallbladder, it would cause biliary colic, and it's a lot worse after eating. As we explained earlier, when the food comes through the digestive system, it sends messages to make the gallbladder contract. This contraction against the blockage causes a lot of pressure in the gallbladder, which causes the pain. Therefore, eating less fatty food prevents biliary colic attacks and also stops gallstones being formed in the first place. Biliary colic is a severe pain associated with nausea and sweating, and typically lasting around an hour until the stone moves out of the duct. Although biliary colic is extremely painful, it's not a serious complication. However, if the stone gets stuck in another part of the duct and is not moved, this can lead to serious complications. Complications such as infection or inflammation of the biliary tract. For example, in the gallbladder, where we call it cholecystitis, or in the actual biliary tree, which we call cholangitis, or even in the pancreas, which we call pancreatitis. These have more severe symptoms of pain, fever, and even jaundice, which is when your eyes and skin go yellow. Any of these symptoms would warrant an immediate visit to the hospital. If people have any of these complications or recurrent attacks of biliary colic, then they'll be offered keyhole surgery to remove the gallbladder. This is called a cholecystectomy. So thank you for watching. I hope this has helped you better understand gallstones. I put some clarifications and some useful links below. If you like this and want to see more, please subscribe. Thank you again for watching.